All right, I believe we are live. So welcome to United Medical ACO weekly event. Today is May 20th. My name is Kemal Erkan. I'm the chairman of United Medical ACO. We are going to cover some of our weekly topics. And I just need to make a couple updates here to make sure that everything is looking okay. So that should change in a minute. So we have Donna Ganku and Sean Donovan with me. Well, Sean is in the same room, but Donna is a little bit remote from us. Donna, how are you doing? You're on mute.
Very good, thank you.
So we were going to have a guest speaker today, but Sean just got a news maybe a little after 1. So what happened?
That's last minute, caught in traffic. So we're making an on-the-fly adjustment here, but it should be good.
Okay, so this is the second time we were stood up by a senator, right? So
yeah, so one.
We won't hold this against them.
Mm-hmm.
Oh.
Maybe we will, I don't know. Well, she apparently has internet problem, right? So,
yeah, she said she's going to be in an area where she would not have adequate Wi-Fi connection, so looking to reschedule.
Also in Delaware, everywhere is Wi-Fi. Like, why is she not able to? Like, this is Biden.
Could be underground. We don't know what they're up to.
So, this is the Biden state, right? So we should have internet problem.
Exactly.
So, all right. So we're going to start with start our session with our COVID update first. Just want to make sure that I have the right one ready here. Yeah. So Sean, you're on.
Yeah. So with our COVID updates, as we look back at the past few weeks, the U.S. did regain that #1 spot of having the most daily cases documented. So last week we were at around 84,000, I believe, cases on the daily average, which now it's actually increased to just under, looks like 97,000 we're almost at. So as the U.S. is in fact increasing case-wise, if you look on the right side of our graph there, we have the death rate is actually going down. So that is good. We know that since the Omicron virus, even though a lot more people were getting infected with the later variants, the death toll was actually a lot lower, so that is good. So it is obviously spreading still, increasing in the US. We're at, like I said, around 90,000 new cases averaging daily. If we look at our next graph, we do have the uptick now. So we did have the extreme drop off from the Omicron in the winter, but now these cases are steadily increasing. So we are trending upwards on our daily count. And then vaccination-wise, we are steadily increasing. The U.S. compared to Delaware, the Delaware is actually going up a little bit faster than we kind of had like a plateau a few weeks ago, about a month ago. But now they're actually increasing around 0.3% across those categories. So it used to be around 0.1%, but now it's sped up to around 0.3. So we do have across the nation as a whole just over 220 million people fully vaccinated, and then of those 102.5 having received first booster and 12 million having gotten multiple booster shots. So we do have those comparisons there. Like I said, Delaware percentages in the margin on the right hand side are increasing roughly 0.3% now, which I'm actually a little curious what's going to happen, say at that group over 65 years of age. Once they reach 100%, do we know? Like,
they become presidents, so they will run for the election.
There you go. So we'll have a lot of presidents running, hopefully sometime soon. But yes, it's definitely good to see that it is steadily increasing and rising a little bit faster than it was the previous weeks and months looking back.
Sure. So now, what we know for this week, like since last week to this week, nothing much. Nothing changed, I would say. Mm-hmm. So one of the big issues that we have is daily infection number is so big.
Yes.
Some of those people do end up going to the hospitals. So I think some of our habits did change a little bit. Although I can tell you, like this week, there was a social event this Saturday. Bunch of doctors, we were going to get together. It's canceled because they didn't feel safe in public. So normally they were out They ran 10K last week, but this week they didn't want to risk it. So because they see more patients with these problems. And then we still don't have a good understanding or good clear picture from China what may be happening, what's being isolated, right?
And another thing too, these variants is, as we see, one, when the Delta came out, way more deadly than the initial wave of when coronavirus itself was first, brought to us. And then now if we're looking at, say, the Omicron, where it was spread much more easily, but the mortality rate, well, a lot less people were actually dying overall. They were being able to overcome this. So it is kind of worrisome if you're thinking about these new variants. We're not sure, is it going to be an even weaker one where it's, even less severe symptoms, or could it actually end up becoming stronger as, as these things mutate? They do become harder for our bodies to fight off. So it's also kind of a gamble there, as we're not sure if it's going to become, even more severe than what we've seen on any of the previous variants. So it's still risky, and we want to make sure we mitigate our chances of, contracting it.
So it is risky for sure, but I think people are going to continue doing what they want to do. And summertime, and tomorrow is going to be 90 degrees.
Yeah, I know.
So many people, I'm sure, will be out. But see, you get excited.
Summer's knocking on the door.
Now we have, since we were going to have a guest speaker, normally we have 15-20 minutes for allocated for the speaker, and we were going to discuss the state licensing board, not the licensing board, the resources board.
Yeah.
And also there are a couple new items that I have some actually questions for her, which I believe we are going to reschedule it hopefully before June 18th. June 17th, Brian Townsend is confirmed. Yes, so, these changes do happen, as everyone knows, but because we don't have a guest speaker, so we want to kind of dive into our clinical topic, but also what we see day to day from our case conferences. Yes. So the one that we are going is, so Donna, one thing that it took a little bit while, but I understood now that actually Sean's specialty or his major was involved with these things. So then dementia is what we're going to discuss today. And why we are discussing is because Donna and myself, we run daily case conferences. What that means is we have 3-4 nurses on each team, social worker, us, one member from business development for each team. Sean is with me, and Kim is with Donna. So there's a group of maybe 6, 7, 8 people in 2 different groups. We are going through patients who may have more complications, who may need more support from us. And what we end up seeing now is there are some social issues. So when we start kind of labeling them under maybe social determinant of health, then there's the mental health crisis. We covered the pediatric part of it. So we went through all those, but then just to kind of taking a step back and just explain what dementia is. And there's a lot of people are using this pretty loosely. So Sean is going to give us a little bit background on the technical terms.
Yes.
And then Donna and we are going to probably share some real life examples or maybe cases that we have.
Yeah. So also just to piggyback on your intro there, dementia, just to remind everyone of what we've been talking about in previous sessions with, dementia here. Obviously, it has to do with our cognitive, in the brain, but also other previous sessions where we had our depression. And we just want to kind of remind everyone that there is a focus too on mental health, and especially if we think of our population, the average age and lifespan is extending as time goes on. Back in the day, people, was lucky, they make it to 40, but nowadays we're seeing people living well into their late 80s, early 90s. And obviously there are different health risks and factors that then come into play as you get older in age. So becoming obviously a more prominent and important thing that we want to, number one, educate everyone on, and just make people aware of, what are these things, what are symptoms, what are different treatment options. So we just want to make sure.
So you want to kind of slow down a little bit in case we have people who are watching us who may have these conditions, they may have difficulties to follow you.
Yeah.
So now we do have actual patient population that we deal with who are actually going through these issues. Understanding and getting the right help is important. So in many cases, dementia and Alzheimer's disease, they're being kind of used interchangeably, right? So when we actually kind of taking a step back, what we are able to see is, well, they're not interchangeable. So then we need to really understand what types of dementia are there, and then what we see the most. And also last week, we were going to go through the Parkinson's disease, which is not as much as Alzheimer's, but it is also related to dementia. So,
just as Kemal was saying here, so dementia is our umbrella term on if you want to think of different cognitive diseases and health factors, that may affect people. So dementia is our broad, loose term used to refer to these cognitive impairments. And underneath that umbrella, as Kemal said, Alzheimer's is one of the most prominent that we do see more often in people who are suffering from some form of dementia. And other ones that are included underneath that umbrella would be our vascular dementia, which we'll get into in a little bit. We have Lewy body, and then obviously Parkinson's is some. And there's just a mix of different specified diagnoses that could be placed on one person who is suffering from dementia as a broader term. So as you're mentioning, we do have our patients here that we manage under the UMACO that do pop up in our case conferences in the morning, and who, we look at their charts, we look at the type of care that they're receiving, and what kind of protocol we're going to go through. And so for dementia as a whole, we do have 117 patients that we are managing right now who are, like I said, one of these.
They came through our case conference, so that's important. So we have more out of 115,000 patients.
Yes.
So
to remind
there are
everyone,
more which are diagnosed, but from the case conference,
correct.
Those are the numbers.
Yes, as Kemal mentioned, the teams on our case conference, what we have gone through and reviewed these patient charts, of those, we've come across 117 who have dementia. Following up on that, as we said, Alzheimer's is more prominent as a whole, and also did appear in our case conference as we had 93 patients with Alzheimer's, which is actually more common in the US. It has over 3 million cases a year. So we have Alzheimer's, and then, as I mentioned earlier, vascular dementia is another one we wanted to touch on, where that's actually caused by a problem with the supply of the blood to the brain cells, which does affect, obviously, your cognitive ability.
So let's take let's stop there for a second. So Donna, what vascular dementia, when I hear the description of that, I immediately went back to our diabetes live event 2 weeks ago with Dr. Gary Singh. So it, like that time, I should have known, but I didn't. And the relationship with the patient with diabetes, with vascular disease, which are mainly, a lot of them are usually together. Now it makes a lot of sense to see why those patients would have dementia, because there is some physical impact rather than the tangible impact there, or it's caused from the tangible changes.
There's definitely a correlation seen.
So someone who's not taking their medication on a regular basis.
Right, or patients who have had a stroke, right? They have, I think that's one of the things Dr. Singh was also talking about, is realizing there can be the physical and then the cognitive issues. Some can have both, and some can have one or the other, depending on which side of the brain the stroke occurred on. But very important, and like he mentioned, that people get involved with their cardiologist early on so that they can prevent those things.
Absolutely. So, but I think one of the reasons also we wanted to share this is because there are there are social behavioral issues, or maybe social setting, from the social setting that we are in. When patients are diagnosed with dementia, and one of the dementia, what's available out there, if they don't have good support from the family, and do they even qualify going to the nursing home? Do they get some help? Some of dementia is actually reversible, while some of them is not. So I think with the nursing home culture that we have here in this country, as the aging population is growing, it becomes more like a public health crisis to take care of patients with these conditions. And a lot of people are going out of their way to make it support their families. But in some cases, if you don't have the technical background, you're not able to really support. So Don, I know you probably know more about these than we do. What you see on your side of the
right. And sure. And there is a lot to think about, because there's the financial component, what it costs to put them in a private facility versus what it costs in a public facility, and where you feel comfortable.
So,
Can you hear me? Sorry, I thought I froze for a second. Yeah. A lot of times older adults want the stability of staying in a familiar place where they feel comfortable. They're used to the same surroundings. And then again, to your point, what they can have in the home. If there was an event, a hospitalization for any reason, sometimes they do qualify for like home therapy, at least for a period of time, to assess what they are able to do physical therapy wise, occupational wise, because occupational therapy focuses more on the activities of daily living. So what they can do safely and independently, and also building their endurance and making sure they are safe to do certain activities.
So now that's when we were actually looking into improving our outcome. We were looking to see if the insurance companies can actually partner with us and maybe have a specific team dealing with helping these patients. But then the other thing, Anthony Anugu, our other director of contracting, he and I, we are working with the governor's office to make a point saying that, look, we may be a for-profit organization, but we are providing the same service, just like the non-for-profit companies, hospital systems are doing. They get 5, 6, 7 times more payments, and then we are doing that with the limited fee schedule. So why don't we actually utilize some of the state resources for, of course, it needs to be controlled and fine. We are open book, but we shouldn't be just discriminated just because we are for profit when we have 115,000 patients in our system. So, and I really hope that we can actually go through this issue and then see the help from the governor's office, because these patients require extra support. Like they require expertise. So you can't just take care of these patients, right?
I could just add in here too. Part of my schooling when I did double major in psychology and cognitive science, and part of the requirement was actually to have a field study class experience. So I did actually have a whole semester where I'd go for about 9 or 10 hours a week at one of the nursing homes, and I'd actually help with their activities and what they would do with their socializing. And it actually was definitely an impactful experience where, it's sad to say, but I remember having like the same conversation with a particular woman each time I would visit, and she'd have no recollection of who I was, if we've ever met before, or sometimes there would be people who, oh, didn't I go to high school with you? And obviously, they're mistaking me for someone else who they think who I am.
Mhm.
So these type of patients, it's not the same as, oh, I have, a sore here or something. I know what's going on. I'm well aware of where I am in my treatment, what I need to do. Whereas a cognitive disease like these, with dementia, it definitely has its own twist and more difficulty on managing it, both, from obviously the patient themselves, but also providers on how are they going to be impactful on being able to help these people in the most positive way, when you face these, rather unique challenges with communication and adherence to certain programs as well.
And the one thing to remember along with that, Sean, is absolutely, and the short-term memory is right the first to go. So they might not remember a conversation an hour ago or 5 minutes ago or yesterday, but sometimes you can have a conversation about something that happened 10 years ago, and they can remember that vividly. And then to your point, because I had a friend whose mom went through that, and at the end, she thought her daughter was actually her mother. So they can relate, they know that they know you, but sometimes then they start misplacing who you are with someone else in their life because they're remembering the long ago from multiple years ago, and can remember things very vividly and give you count by count. But that's where I think you were going, Kemal, you get concerned about people and what they need today because you're afraid that they're going to turn the stove on and forget to turn it off, right? They're going to open the door and forget to lock the door, so that then they're in the house by themselves. Or sometimes they start walking off because they don't foresee where they are. They think they're somewhere different. And I know my friend's mom used to do that. She always said, I got to go home. And she would literally start walking out the door. So it is a concern for their safety as well.
So my older sister's mother-in-law has Alzheimer's, and every time I go and visit, so she remembers me. She knows who I am, but she has no recollection of that short term. So we have dinner 2 nights in a row. And if she didn't see me during the daytime, the entire conversation, she knows that I live out of country.
Yeah.
So she remembers that. So because that was 23 years ago now. And then she's second day, she's like, so you just got here today? I'm like, yep. So I just got here today. So, but then I think, Donna, when you were explaining this short-term memory versus what they can remember, that's making it very tricky because in some cases they remember so much from the old days, then you feel well, maybe they really don't have any problems.
Yeah.
Yes.
Is it really?
Yeah, you have to make sure that when you're looking at that situation, that you're looking because you get hopeful when they're like, oh, I think they're okay because they remember all this stuff. But then when you look at the last week of events, to your point, and then it's did I take my medication this morning? Or if they're in charge of their own medications, are they able to track taking the right medication at the right time? So I think you're right. And it's from the personal perspective, because you and I are both experiencing similar things. You kind of get hopeful about certain things, and then you kind of get let down on the other side when you see that they're not remembering something very important from just a few minutes ago.
So the other, I guess maybe in a different group, Parkinson's disease, we didn't put the Parkinson's disease right under dementia because one of the articles that I was reading, so Alzheimer's is the hallmark of dementia, but Parkinson is a little bit different. So it starts totally differently, where the symptoms are more physical than at the brain level, but somehow they are turning into some type of dementia at some point. Now, you guys may or may not know, I'm sure I mentioned it in some conversations, but I actually, one of my first jobs in the United States was I was taking care of a patient who had Parkinson's disease. So this was a family friend, I lived with them for 20 months when I was a student. This is 99 and I think from 99 to 2000, so a total of 20 months. So the family, the wife and husband, they had like 26 years apart. And then the guy was 74 years old and he was diagnosed with Parkinson's disease that time. So 22 years ago, this was even today, we don't know enough, but 22 years ago, it was totally unknown. So I actually saw the entire process in front of me where a lot of physical limitations were there. And then slowly it got into forgetting stuff, not remembering stuff. Yeah. He actually couldn't remember my name. I think that in the beginning, he was doing it deliberately. So then later on, it just, he used to call me Cameron. So it just, like he couldn't get out of that. So then, because then once he started forgetting things, that kind of stuck with him. So he remembered me with the wrong name. He was a great guy. But seeing, Donna, you probably have some background on the issue of like nursing home, finding the nursing home available. Even if you have the benefits, in some cases we don't have enough beds for these types of patients, and because they're also healthier physically, in some cases they don't want to be in a nursing home. So there's that social. Well, I don't know if I want to label this under social determinant of health, but it is in a way that these people do require special expertise, group of people helping, not just anyone. So, but one of the reasons that we want to cover this is because we want our patients' families to know what may be happening with their parents, especially because, like, if I read you so okay, Donna, let's do a test with you. So I'm going to diagnose her. So do you have? Like every once in a while, do you have like little memory issues, like you don't remember exactly what happened?
Not so much what happened, but I can tell you there's times I go upstairs and forget exactly why I went upstairs and what I went to get. So I have to like retrace my steps.
Sometimes difficulty finding words.
Occasionally, yes.
Okay. Well, this may not happen to you. Getting lost while you are driving.
No.
Okay, so you are 2 out of 3 so far. Difficulty reasoning or problem solving?
No, I don't think I have any trouble with that.
Even with the work? So, okay, so then it goes to difficulty with planning and organizing, difficulty with coordination and motor functions, confusion and disorientation. So there's like 1, 2, 3, 4, 5, 6, 7, 8. Out of these 8, 4 does happen to us. Yeah. Especially after COVID, actually, it does happen more. So like not remembering things. And then as you said, like sometimes like I'm in the patio and then I go inside to pick up something and I forget what I was going to do. And, these things are happening. So but I think the reason I'm highlighting this is because, we are on the younger side. So it may not be a big problem for us, but if you see these types of symptoms with your elderlies, that should be alerting. I mean, because they're like so common, like even, for mid-age people, this is already happening. So then we don't want to go through this without identifying, detecting, diagnosing them in a timely manner, because some of them are reversible.
Yeah. I think with almost every type of disease or health factor, the earlier you detect it, the better your chances are with recovery and actually battling through whatever that particular ailment is. And I know this could be not a touchy subject, but I know a lot of people, when they get a little bit older, they don't want to feel like they're losing their sense of independence. that they necessarily have to rely on someone. They want to say, I can take care of myself. I know where I am. And they don't want to feel like they're losing their independence, but also maybe putting a burden on their family. Like, oh, now they have to take care of me. They have to spend time out of their day where they're missing this event because they have to, do this for me or bring me to this appointment, where they kind of are not denying it, but, they're trying to mitigate and play down certain symptoms. Where on the flip side, if you do get these checked out and, detecting things earlier, it's actually more beneficial for you in the long run.
And I think you hit it, Sean, because it's how often is it happening? I mean, Kemal or I could have it happen once a day because maybe we're trying to multitask and do so many things at one time, right? We're trying to work, take care of mom, do this, do that, and so in your haste to do that, but is it happening to your parent, your aunt, whoever, multiple times a day? And then sometimes when you remind them, to your point, they don't want to recognize that something's happening. So you might hear the statement, oh, I knew that. I was just getting ready to say that. I was going to do that. So you do need to just be aware. And it's not that you're trying to kind of accuse them of something, you know what I mean? Because then they get very defensive, but just being mindful and trying to figure out and maybe take them to have, a neurological, evaluation done so that they can diagnose something early and figure out what they can do.
There's also like a lot of things that lead to these types of symptoms, onsetting that you may not even be aware of. I know in one of the articles I was reading, it was if you have a thyroid that's actually not performing at its optimum, levels, or underactive, that can actually end up leading to dementia later on. Just because another part of your body, isn't maybe at its optimum function, you wouldn't, necessarily be aware of that. You just think, oh, day to day, everything's fine. And then, like we're saying with these symptoms, it starts with something small like Parkinson. It starts with a tremor in one hand, and all of a sudden it progresses later on. So as you were saying, it's kind of a gray area. We don't want to push on them. You need to go check out. You have this. You don't want to, like you say, accuse them, but at the same time, we want to recognize and make sure we are 100%.
Well, prevention, part of the prevention is diagnosing these types of issues early on. So that's why we have to be, kind of like watching very closely with the elderlies. That's
and also, right, and keeping in mind that keeping them active too is very important, right? Because it keeps your brain stimulated, even doing puzzles, things like that make them think and problem solve. One of the questions you were asking, Kemal, but exercise, I mean, and when I say exercise, they may not have to go play tennis or, but walking. One of the occupational therapists here was talking about endurance, building up that endurance and doing some standing activities for 1 minute, then walking for 2 minutes. Things that keep them, and also keeping in mind some certain foods that are good for our brain. Certain green foods like broccoli and things like that. So keeping your brain healthy is an important thing. And I think that ties in like with our dietitians, because like fatty oils, right, from like fishes and nuts and things like that, just things you can do. It doesn't mean you have to only eat those foods, but keeping them, as part of your diet to help you out. Like we talk about heart healthy, we want to talk about brain healthy as well.
So again, one of the reasons that we want to do this is because we want to communicate the problems with public, but who are part of the caregivers. I include the state of Delaware and the federal government. So that's 50% of our patients are between Medicaid and Medicare. So if we have a better integration partnership and then can get over the for-profit part, then we can have a better approach so that, because we are responsible, we know what we are doing, and we do this less expensively, with either same or better quality in many cases. Right. So we did actually, we did prove that so many times. So right now, we are running one of the least expensive accountable care organizations in the state of Delaware. So, and it's not 1 year, it's not 2 years, it's in the last 6 years. So then, and it's not just one contract, it's multiple contracts, like commercial, Medicare, Medicaid. So we want the state of Delaware to hear what we are saying here. So there should be a better partnership to approach elderlies, especially who are suffering with these types of issues. The other things that we discussed in depression, which some of those issues are going, following them through their elderly time, I guess. So that means we have to work on that other group as well. So like this is not just one piece, just working, isolating. So it is just going to continue if we don't take care of these issues. And we don't want people to become 80 years old and run for presidency. So, or if they, we don't want them to have dementia. So thank you for joining us. So
Thank you.
We're going to chat about Twitter a little bit. If you want to stay, you can. But I know you have stuff going on.
Thank you, Kemal.
Thank you. All right. So, Mr. Shanley, this is what happens if we had to guess. We were going to do all these. So,
yeah,
then it's 2:45.
Right.
So now let's talk about Twitter a little bit. So, what is happening?
So, as we mentioned in our previous sessions, again, we do predict things, and they seem to come true the majority of the time. We had mentioned that Elon was postponing, that deal on actually purchasing Twitter until he found out how many bots accounts, were accounted for and made up what percentage. And I believe the numbers, he wanted it less than 5%, and the Twitter CEO at the time, and their board was refusing to come out, and they could not deny or confirm that number being low enough. So that deal was actually postponed further, I believe, if not.
So it's kind of like interesting that I'm looking at some of the tweets for the Twitter issue. So 20% of the accounts are fake. This is from Elon Musk's account directly. So 20%. But what he was saying is that half of Joe Biden's followers are, was it half or was it 20 million? Just one of those.
Significant amount, regardless, still.
That's a big number.
Yeah.
So that means, why do we have it, right? So like, why are we really talking? Like, we're not part of Twitter, but we used, well, at least I use Twitter, Sean doesn't. So
starting,
I'll pick up. So, but the problem is, this is influencing the way that we make decisions.
Yeah.
So when you see someone is being followed by 3 million people, what that person say becomes important.
Yeah.
And it's visible. So so that's why this is important. But also from the business standpoint, when I see someone like him just starting this conversation, giving 43 billion, and now then just taking a step back and saying that, well, that value was with 95% actual real accounts. Now it's like 20%. So
it almost makes things like fraudulent, like you wouldn't say we're seeing.
I think he's a smart guy.
Yeah, we're seeing this many more patients. Oh, are they real patients? No, they're bot. Like you wouldn't say that. So across any realm in the business field, you'd want it to be accurate.
Well, so also like how these things are very politics. Like again, it's just it actually makes me sick. Now he's being kind of labeled so like almost deliberately on one side. Doesn't have to be like you. And I don't believe he's one or the other side. I think he's just going to be. I would say there isn't one person who's just pure Democrat or pure Republican. So we have different values, and sometimes that makes us, that's where we are becoming independent. So in the middle, in many cases, or we may have on social issues, we may have Democrat values versus on the financial issues, we may have Republican values. So putting people in these frames is not the right way to operate. And now they actually, I don't know if you saw
I saw
it was last night.
Yeah, you tweeted the accusation now.
Yeah, so
Trying to
like this
throw
just
shade on him.
from 2016, right?
Yeah.
What was that? So
That supposedly you paid off $250,000 for
because someone is saying that he
Sexual
exposed
harassment.
himself
yeah.
and then offered for sex. So
Yeah.
250,000. He probably paid that not because he did it, just because he didn't want to have the publicity.
Right.
Probably, but now it's just coming out.
Yeah, which is ironic timing if you think.
So now next week we do want to look into the monkeypox, right?
Yeah, so that was kind of emerging. I know it's popping in the UK. That's a lot in the latest news articles, but I know there are cases in the US, I believe.
So yeah, we have actually more than one. Massachusetts and the I think there are a couple other states who already had the. Let me just see. If we can actually just prep that for next week. I know May 18th we had one, and then I don't know if this would become a bigger issue.
Right. I mean, it's another viral.
We just need to be careful. Like just like unknown is the enemy. So if it's known, then we know what we can do. But if this is happening, we don't want to find out too late. So. And then next week we have the RCM presentation, and we are gonna have some of the follow-ups on the global crisis with the financial and the war in Russia is out of control. It is the third world war is developing. I think it already started. So. Hopefully people can get their act together and then stop this madness. And I'll just say that openly again and again, because this war is not going to benefit anyone. I have no idea why we are in it. So hopefully it will stop before we lose too many people.
Right. And now, like you said, we will touch on the financial, economic, and, kind of like you said, that recession. Say we're down like 15% now in stocks, and another one too. Actually, I don't know if it's just all the tech stocks are going down, or if it had to do with that tweet with Elon. But I know like Tesla was down over 10% just today, so we are seeing a big sell-off in all these.
I mean, right now everything is kind of in the air. So, and that's the unknown, right? So, well, if we are doing this, from the pandemic. It was going to impact us already. So if we are trying to cover that up with the war, that's a huge mistake. And that's what I'm feeling. So like just own the problem and then say, this is what it is. So we lost 1.5 years. Instead of just going and starting another war somewhere else, this is just going to make everyone, everything more difficult for everyone. And we really don't want to see this. I'm hoping that it will stop soon. So that's what we have for you guys for this week. We have Bariatric Friday coming up at 3 p.m. Dr. Erkan is going to join me, and we're going to thank Donna and Sean for joining me, and we'll see you guys next week. Thank you. Bye-bye.